This presentation is going to be about mitochondria and general anesthesia from an anesthetic perspective. What happens during a general anesthetic with the mitochondria? We know very well that mitochondria are the powerhouses of our cells. They interact with microtubules, and according to the Penrose-Hameroff hypothesis, which is called ORCH OR theory, orchestrated objective reduction, and qubit theory, they may generate consciousness. There are drugs which suppress mitochondria. We will see what they are, and they may cause mitochondrial dysfunction, endoplasmic reticulum stress, unfolded protein response. They may contribute to perioperative or postoperative nausea and vomiting. When mitochondria go down, there will be a lack of energy, and when there is not enough energy, the metabolism will slow down, and a lot of waste proteins usually, but equally carbohydrates and lipids as well, may accumulate, and they are regarded as waste by the body because they are dysfunctional. They don't function properly. They are not folded properly, and they don't function properly. And therefore, they need to be digested. They make a biofilm, and this biofilm, or dampness in Chinese medicine, needs to be digested and cleaned up. And this digestion process, which is the empty heat or chronic sterile inflammation or inflammatory process, is there to digest these waste materials and provide an alternative source of energy. There are luckily drugs which stimulate mitochondria. They are steroids, and they have a clinical significance. We will see it from case studies. This slide is about me and plant medicine. I am basically an agriculturist and a physician. I also studied traditional Chinese medicine as a hobby, and now it became a secondary profession after anesthesia in intensive care medicine. I studied Chinese medicine in Amsterdam, London, and Sydney. I started a PhD into cartilage repair with plants, and I have my online private integrated medical consultation. This is me in Amsterdam. I was in Amsterdam and I studied traditional Chinese medicine there. This slide is about the interaction between mitochondria and microtubules. Mitochondria may produce biophotons and electrons, and these biophotons usually go to the microtubules, and they act as waveguides. So with the microtubules, mitochondria may generate an electromagnetic field in the body, and which serves some purposes. This is called basically qi in Chinese medicine. This is an electromagnetic field which serves three purposes: basically cooperation, coordination, and communication. It starts from embryology and embryological development along the fascia, and it also persistent functions throughout life, and responsible for the three basic functions of communication, cooperation, and coordination. These are some photos about the cytoskeleton. The cytoskeleton is made of microtubules, and we can see this interconnected network of microtubules. They work throughout the cell's life, not only in cellular division, mitosis, but it serves as a means of communication as well. This is a video about how the microtubular network vibrates on different frequencies. This is just a simulation, but you can see that the microtubular vibrations happen in response to certain frequencies. We can provide evidence that some general anesthetic agents, for example propofol, may block mitochondrial and microtubular function as well, and this microtubular blocking function may contribute to loss of consciousness and to the generation of a general anesthesia or narcosis, sleep. At the same time, or on the other hand, propofol also blocks mitochondrial function and may produce neurotoxicity by inducing mitochondrial apoptosis. We can see that there are many drugs administered during a routine general anesthetic procedure, and these drugs all block or impair mitochondrial function. At a closer look, we can see that there are some very frequently and commonly used drugs such as paracetamol, diclofenac, amiodarone, aspirin, tramadol, I'm assuming all the opiate receptor agonists, and buprenorphine as well on the top right corner, and amiodarone and many other, carbamazepine for example, but carbamazepine is not routinely used in the general anesthetic practice, but all the rest are used quite frequently. So we can easily imagine that when the patient comes in for an operation and they get anesthetized, they start off with an impaired mitochondrial function, because this is the way how they become ill. So, and we give them certain medications to induce a general anesthesia, and these medications further impair mitochondrial function and weaken the electromagnetic field. We can see the antibiotics here, gentamicin and ciprofloxacin, which are commonly used in perioperative antibiotic prophylactic practice, and these antibiotics and many other antibiotics as well may also cooperate or contribute to mitochondrial dysfunction. So this little table shows on the left hand side certain medications or drugs which may inhibit mitochondria, and on the right hand side those drugs which stimulate mitochondria. So on the left hand side, non-steroids, paracetamol, tramadol, buprenorphine and amiodarone may inhibit mitochondrial function, and on the right hand side there are not many, but noradrenaline, epinephrine or adrenaline, dexamethasone and other artificial synthetic steroids may stimulate mitochondrial function. This is evidence about the effect of noradrenaline on propofol-induced mitochondrial dysfunction on human skeletal muscle cells. So noradrenaline is basically similar to adrenal steroids and its effect on mitochondria. We can see some natural mitochondrial stimulants, for example ginger, and this is the evidence underneath. It can be seen that ginger may also stimulate mitochondria with, for example, 6-gingerol, the active ingredient. Cinnamon also helps mitochondria, and cinnamon intake may alleviate the combined effects of insulin resistance and acute stress on brain mitochondria. Fenugreek, Trigonella phönum, may also help mitochondria, and these three herbs, such as ginger, cinnamon, and fenugreek, shangjiang, rogui, and huluba, respectively, are used to stimulate mitochondria in traditional Chinese medicine. How to recognize preoperative mitochondrial dysfunction? This is the chance to find patients and select patients with mitochondrial dysfunction preoperatively. These patients will have muscle fatigue and immune deficiency. They usually feel cold hands and feet, bloating, poor digestion, and diarrhea. They have slow metabolism, weight gain, and water accumulation. Importantly, they usually have hypothyroidism or adrenal fatigue or Addison's disease and low back pain. These signs basically correspond to Qi deficiency in Chinese medicine, and we can easily find further clues to mitochondrial dysfunction if we regard the 5 basic functions of Qi in Chinese medicine, which are holding, warming, defending, transforming, and transporting. And so we can see that the 5 main functions of the Qi or immune or mitochondrial function are here in this slide, such as defending immune deficiency, feeling cold hands and feet, so poor peripheral perfusion, which is basically warming the body, and transforming and transporting. These are metabolic functions and digestive functions, digesting both our food and the waste materials as well. And it also holds the blood in the vessel, which is basically due to the blood-borne magnetic field in traditional Chinese medicine. So, and this is why when mitochondria go down and waste will be produced, and there will be a subsequent sterile inflammation, and this sterile inflammation may cause the capillaries to open and increase their permeability. Everything swells up, including ligaments and tongue. This is why the Chinese see and look for a swollen tongue with teeth marks on the edges, and these are all signs of mitochondrial dysfunction. This waste production due to a low energy environment is called unfolded protein response in Western medicine. I just talked about it. Mitochondria go down, energy deficit, metabolism slows down, and dysfunctional waste generated, and this waste needs to be digested. This is called oxidative stress in Western medicine. This oxidative stress is basically the bushfire. The only problem is that it is very non-specific. It means that it not only does it digest or burn waste, but it also burns healthy structures. The problem is that when these healthy structures get burnt and destroyed, it further impairs our chance to recover from that low energy state and mitochondrial dysfunction. So what are the signs of UPR, this unfolded protein response? Biofilm formation. These patients usually have depression, psychosis, bipolar depression, bipolar disorder, even psychosis, anxiety due to neuroinflammation, and chronic sinusitis as well. Interestingly, when the limbic system goes down in energy, there will be a subsequent low level chronic inflammation, and this limbic system includes the olfactory nerve and the nose as well, so there is a good chance to see a link between depression and chronic sinusitis. There will be dizziness as well when there is an ongoing high level sterile inflammation. There will be a subsequent drop in the zeta potential of the blood, which means that the blood becomes thick and dense, and it is difficult for the blood to circulate properly up to the fine capillaries of the brain. There will be low perfusion, and it may contribute to dizziness. Chronic cough, vaginal discharge, pelvic inflammatory disease, and polycystic ovarian syndrome, various gynecological disorders, and myasthenia, obesity, arthritis, because joints are of low perfusion and places in the body. Therefore, if blood is thick and dense and cannot circulate properly in the small vessels, it means that the joints will not get their nutritional support either. Therefore, there will be a subsequent arthritis. Interestingly, in Chinese medicine, this thick blood, which is called blood stasis, is diagnosed from distended sublingual veins, and it may contribute to hypertension. Interestingly, this biofilm formation comes in various forms, for example, dizziness, motion sickness, and nausea due to biofilm in the stomach. Therefore, there is usually a history of any of these conditions, and they may signal and warn of impaired mitochondrial function and biofilm formation. Therefore, there will be a good chance to see a history of postoperative nausea and vomiting, even Meniere's disease when there is biofilm in the inner ear, and nausea when there is biofilm in the stomach. So there are UPR conditions, red flags: Meniere's disease, obesity, bloating, diarrhea, smoking, arthritis, recurrent bacterial infections. Obviously, they are very important because there is permanently impaired mitochondrial function and subsequent biofilm formation. There are various autoimmune conditions and even cancer. The Warburg effect is behind that, when mitochondria go down and there is a permanent mitochondrial dysfunction. Waste production and sterile inflammation. So the sterile inflammation will be the permanent alternative energy source in the cell. Psychosis, major depression, and even bipolar disorder we already talked about. This is interesting to the lipid side of the unfolded protein response, which means that not only are proteins affected, but lipids as well, and the accumulation of saturated fatty acids in the cell membranes. They seal it, and therefore glucose cannot go through, and they contribute to increased insulin resistance. They also contribute to neurodegeneration, which is the subsequent or which is due to mitochondrial dysfunction and impaired autophagy or digestion of this waste. cardiovascular diseases, and even cancer. This is the link between Meniere's disease and blood viscosity. So increased blood viscosity has been shown to result in inner ear dysfunction, tinnitus and vertigo. This is sevoflurane and propofol, probably. They induce mitochondrial dysfunction, and we can see that general anesthesia activates the mitochondrial unfolded protein response. This is dexamethasone, because dexamethasone is shown to be able to reduce this unfolded protein response. This is case study 1, a patient with ADHD and depression. So we can see signs of mitochondrial dysfunction in the brain. Mildly obese young lady for an ENT operation, ear, nose and throat operation, on Sunday in the hospital. She is in aripiprazole and citalopram, which are known to impair mitochondrial dysfunction. They cool the neuroinflammation, but they also cool mitochondria. They are used as anxiolytics. Citalopram may also cool mitochondria. It took about 30 minutes for her to wake up, even when the BIS monitor was on. So the total intravenous anesthesia was carefully monitored with brain wave analysis. And this was a research from Cambridge. Rigidity, trembling and weight gain in edema and shuffling gait and forward tilt due to antipsychotic medications, which are respiratory chain complex 1 inhibitors. Again, mitochondrial dysfunction. Sertraline also damages mitochondria. Most antidepressants and antipsychotics are not beneficial for mitochondria, so we can see that the medications we give to cool the neuroinflammation, for example in psychosis, they may impair mitochondria as well. So it will be very difficult to recover from these conditions. This is case study 2, a simple urology case with impaired renal function, and the patient was given propofol and remifentanil, which have a short duration of action, but the patient was also given gentamicin. The patient had low blood pressure, which means that there is a chance of mitochondrial dysfunction again. So after giving all these medications, it is not too difficult to imagine what is going to happen to their mitochondria. Gentamicin, auto and nephrotoxicity, which means that toxic to the ear and the kidneys, may be due to mitochondrial dysfunction again. This is the effect of dexamethasone, and when it is given in combination with gentamicin, and it was beneficial for these patients after in vertigo management. This is case study 3, urology again, and patient had a history of asthma, smoker, and peritonsillar abscess. So we can see subtle signs of mitochondrial dysfunction, constant vomiting again when the stress wants to come out of the body through the mouth and in the form of vomiting. Ovarian cyst, again called pelvis. Polycystic ovarian syndrome, again called pelvis, with a little bit of UPR, unfolded protein response, and waste production in the pelvis. And 2 recurrent renal calculus. So renal stones, kidney stones were there, and we have seen evidence of a stomach biofilm in the case of vomiting, because it induces nausea and vomiting, and gentamicin and Tiva was given, as well as dexamethasone. So how can we educate our patients to preserve mitochondrial function? The Mediterranean diet may be beneficial for mitochondria because they are rich in flavonoids and herbs, spices, which may have a beneficial effect on mitochondria. Remember that ginger, cinnamon, garlic, oregano, and rosemary, they all have beneficial effects on mitochondria. Steroids are not a magic bullet, because we may need to think about membrane dielectric capacitance as well. Remember, the oxidative stress burns the rainforest, including the good tissues and structures as well. Therefore, they need to be replaced with a vegetarian diet. We can see the role of inflammation in the pathogenesis of chronic pain and pain perception itself. So there is a good link between pain perception and chronic inflammation. And obviously endoplasmic reticulum stress, which is basically the signal of an elevated chronic inflammatory level. We can see that evidence that the vegetarian and vegan diet may help with fibromyalgia. Fibromyalgia is said to be due to mitochondrial dysfunction and blood sludging and blood stasis. When the blood becomes thick, it cannot circulate properly in the peripheries, therefore it may block capillaries and induce ischemia and painful muscles and fibromyalgia. This is an official way to promote healthy lifestyle and diet, the British Society of Lifestyle Medicine. This is a series on Netflix. This series investigated the effect of various diets, herbivorous and omnivorous diet, on the health of healthy twin pairs, and this is really worth to watch it. In summary, we damage mitochondria in every possible way. There is an unprocessed emotional trauma very often in the picture, which already destroys or decreases mitochondrial function. And on the top of emotional trauma, there may be diet, lack of sunshine, lack of sport, and various toxins which may further impair mitochondrial function. And meat and processed food may be difficult to digest, and they may make a lot of waste materials, and they may further damage and weaken and exhaust mitochondrial function. We don't have many ways to improve it. Dexamethasone, plant-based steroids, and plant-based diet may help. Thank you for your attention, and if you liked my video, I hope to see you next time. Thank you.